Hi, I'm Jason with Jessica's help. I'm going to show you guys how our InBody machine works today. Right, this is our InBody machine, Jess, so go ahead and take your socks and shoes off, any metals you have in your pocket, jewelry. And go ahead and step on with your heels on the chrome and your toes up front. Just like that.
Okay, so Jason is showing us how to do an in-body analysis, and the reason we use this so often in our practice is because there are upwards of 25 million people in the country with type 2 diabetes. There's more than 70 million that are undiagnosed diabetics. So this test is important because it quantifies or separates out the difference between fat mass and protein mass. So that's why this test is so important. We use this with our weight loss program. We use it for most of our patients in general.
Go ahead and hold your arms out, and you're going to put your thumbs on each part of the chrome. And it's going to sing you a little song here. And now it's going to do your weight, your lean body mass, your fat, intra and extracellular cellular water, and then your segmental lean development of your right arm, left arm, trunk, right leg, and left leg. And then it'll give us your body fat percentage, basal metabolic rate, and it'll give us a printout on how much fat you need to lose and how much muscle you need to increase.
Most important test that anybody should have done in a doctor's office. It's as important, if not more so, than blood pressure readings. Because we're talking about a disease that kills millions and causes blindness, heart attacks, strokes, and that is diabetes. And type 2 diabetes is usually preventable and even curable if you take the right approach. But you've got to know your body composition in order to do that. So it's a very detailed analysis of Jessica's body composition. Sometimes it's more information than people want to know. But unlike a traditional scale, which will just measure what the total body weight is, and that is shown here, okay? But more important than that, this breakdown separates the body fat mass from the lean body mass. Okay, this is the number we want to focus on. So the first calculation is your total body fat, good fat in your body as well as that which you want to lose. The lean body mass consists of your dry lean mass and your total body water. Okay, so the key number, because there's a lot of information on the sheet that we want to show our patients, is how many pounds of fat to lose. And you can see that calculation right here. Okay, it's a very accurate number, and that's the one we focus on with our programs. However, the other very important number is the lean body mass. Any weight loss program has to be able to measure and maintain lean body mass. And the reason is because that is what directly determines your basal metabolic rate, which is the rate at which you burn calories at rest. Ultimately, that's what's going to determine how much fat you lose.
The basal metabolic rate is how many calories my body's naturally burning. Is this with exercise, or is this just...
This is just at rest. That's what basal means. It means when your body's at rest, on average in your case, you're burning 1,354 calories a day. Okay, so if you think of that in very simple terms, that means that if you take in more calories than that, you'll store fat. If you take in less calories than that, you'll burn fat. The problem is that most people cannot successfully do calorie counting. It just doesn't work for very long. So what we just want to do is focus on increasing your basal metabolic rate by increasing your lean body mass. That's the reason that men have an easier time with diets than women too, because we have more muscle mass. So if you have, say, two men, they both weigh 200 pounds, and one's all muscle and the other's not, and you measure the basal metabolic rate, the person with all the muscle is going to have a much higher metabolism. So that person can eat a lot more and not gain fat.
Okay. So someone looking at these results and seeing how the arms are over, that doesn't necessarily mean that they're over as far as being too big fat-wise. That means that
Right.
the muscle is there.
Exactly. It's the lean body mass. Some people preferentially put a lot of fat in their arms, especially women. A lot of it's estrogen driven. That's not what this is measuring. This is measuring the muscle mass. The other information we get out of this, especially with women, is that we are able to measure the water content. And speaking of hormones, most women know that when their hormones change, the amount of water they hold on to changes as well. And these measurements break down our total body water, which in your case, Jessica, you have 73 pounds of your body is water. It's pretty amazing. And it separates into extracellular water and intracellular water, okay? And it gets pretty detailed, but the most important thing to take away from this is you want to be in a good ratio of extracellular water to total body water. Yours is 0.37, which is very good, okay? Athletes or those who have a lot of muscle mass tend to have a ratio that's lower. Whereas if a woman comes to me and says, geez, I just feel like I'm holding on to water and tends to be around her cycles, then what I'll normally see is that ratio is higher. So again, this is a very important test, not just for initial analysis, but for following progress. Because what we do here is we measure over time how this changes. So when we get people started on one of our programs, we'll get this as a baseline, and then we follow them every 2 weeks or whatever the interval is, and we can make adjustments.